He received his Bachelor of Arts and his Master of Arts in Kinesiology from Western University in London, Ontario. And actually that's when I met him, was when he was doing his PhD. Oh, sorry, when he was doing his master's. He would come to McMaster University to teach a class and then head back to London to do his own schooling. He received his PhD in 1992 in kinesiology from the University of Illinois. And he spent 5 years as an associate professor at the University of Calgary before making the smart decision to move north to the University of Alberta. His research program focuses on the role of exercise after cancer diagnosis, including how it may help cancer patients prepare for treatments, tolerate and respond to treatments, and recover after treatments, and improve long-term outcomes. So now I'd like to turn the platform podium Zoom feature over to Kerry for his presentation.
Hello, Nora.
Hi, Kerry. Thanks for joining us.
My pleasure. So my talk's going to be about exercise for cancer patients and survivors. And I'll try and share with you some of the latest evidence for why we might want to be promoting exercise for cancer patients and survivors. And then also some strategies that you can use that are unique to cancer patients in terms of encouraging them and motivating them to exercise. All right, I'll start with a few statistics. Some of you may not know much about cancer itself, but it's a fairly common disease. Over 200,000 Canadians are diagnosed each year. Lifetime probability of getting cancer is quite high, almost 50%. So if you live long enough, there's a good chance that you may get cancer. Unfortunately, cancer is still a very lethal disease. About 80,000 Canadians die each year from cancer. So it's a very serious disease to get. It accounts for 25% of all deaths in Canada. There has been improvements in treatments and improvements in detection of the disease, which have led to an improving survival rate of about 60% overall. Now, that varies dramatically with the type of cancer that you have, the stage of the disease, and many other factors as well. So cancer is also a very heterogeneous disease. It's not, we talk of it as if it's a single disease, but there's over 100 different types of cancer, and they're all quite distinct in terms of how they're treated, what the prognosis is, and so on. But the high incidence rate and the improving survival rates means we accumulate a lot of cancer survivors in Canada. Right now, probably over about 1.7 million cancer survivors. So it's very likely in your community or clinical practice that you're interacting with people that have been through cancer. The challenge, I think, with cancer is the treatments are complex, they're difficult, and they can be prolonged. I would argue that cancer is probably the most heavily treated disease that we have. You will get more and difficult treatments for cancer than you will for any other disease you're diagnosed with. Surgery is common, chemotherapy, radiation therapy, hormone therapy, immunotherapy, and very few patients just get one of those treatments. So you get what we call multimodal treatment. It's very likely you'll have surgery followed by chemotherapy, maybe radiation therapy, maybe even hormone therapy. So these treatments can go on for many months and in some cases many years. Lots of acute side effects, nausea and vomiting, diarrhea, fatigue, neuropathy, pain. There's a long list of side effects that patients can have while they're on these treatments. Most of these treatment side effects will dissipate after the treatment stop, but some do linger, and there are some chronic and late effects of cancer treatments as well. Probably the biggest concern for most patients is recurrence of cancer, but there's also a risk of second cancers, heart problems, osteoporosis, and so on. So again, cancer can be a very challenging disease to treat and with lots of side effects and symptoms. So here's some of the questions that cancer patients have about exercise. First and foremost, is it safe to exercise during cancer treatment? And related to that, is it feasible? 30 years ago or so, it wasn't even really feasible to exercise during chemotherapy because the side effects were so difficult nobody thought this is reasonable to ask patients to try and exercise. And so the feasibility issue is important as well. Will exercise interfere with treatment or response? That's the most important issue for cancer patients. They want to make sure that whatever they're doing, it's not interfering with their ability to complete their treatments or making their response to treatment worse. Can exercise help manage treatment side effects? Can exercise improve recovery after cancer and lower the risk of cancer recurrence? So a very big question for cancer patients related to the risk of recurrence. What's the optimal exercise program for benefit? And then are there any exercise programs for cancer patients that are specific for cancer patients? So there's a massive literature that's accumulated in the exercise oncology field over the last 30 years or so. So I'm really just going to summarize at a very high level for you and then give you maybe a couple specific examples. But there's over 1,000 exercise intervention studies that have been done in cancer patients. So this is an area of research that's really taken off. We have all sorts of systematic reviews that you can go to. And I guess the good news for practitioners is you can get much more specific information now. You can go find systematic reviews that are targeted to breast cancer patients, prostate cancer, hematologic, lung, colorectal cancer, and so on. So we now have so much evidence in this area that we can do these reviews separately for many different cancer types. We oftentimes do them for different phases of the cancer trajectory as well. Pre-treatment, preparing patients for treatment, during the active treatment phase, survivorship, and then also palliative phase where patients with advanced cancer. You can get these systematic reviews for specific outcomes. So if you're interested in the role of exercise in fatigue in cancer patients or depression, quality of life, and so on, there's systematic reviews out there that will summarize that evidence for you. And then we've got reviews focused on certain types of exercise interventions. Aerobic and resistance, of course, the most common, but you can find reviews on yoga and other types of physical activity as well, just for cancer patients. And then as we get more and more evidence, we've got reviews that will focus on breast cancer patients on treatment or prostate cancer patients on androgen deprivation therapy. So you can see we're starting to get very specific information about specific types of cancer, specific treatments for cancer, and so on. So a lot of evidence is out there to help you help cancer patients. Just summarizing maybe a couple studies here and really focused on cancer-specific benefits of exercise. Cancer patients are aware of some of the general health benefits of exercise, but what they're really interested in is what are some of these cancer-specific benefits. So I'll summarize a couple of the key findings related to these cancer-specific benefits. So this is one of the early studies we did called the START trial, where we compared aerobic exercise training to resistance exercise training and usual care in 242 breast cancer patients who were just starting chemotherapy. And we looked at fitness changes during chemotherapy. We looked at quality of life changes. And this was the first study that focused on exercise during chemotherapy for breast cancer. But one of the big concerns was, will it interfere with patients' ability to complete their chemotherapy? And so this was the first study to track chemotherapy completion rate, because we know if you complete more of your chemotherapy, you have a better chance of beating the disease. And when we looked at the chemotherapy completion rate, this measure we call relative dose intensity, so how much of the chemotherapy did you receive? To our pleasant surprise, the resistance exercise training group actually completed more of their chemotherapy than the patients who did not exercise, the usual care group. And even the aerobic exercise group did a little bit better. So this was a suggestion that not only does exercise not interfere with your ability to complete chemotherapy, it may actually help you get these potentially life-saving drugs. And then we followed up these patients 8 years later to look for what for many patients is the most important outcome, and that is, have you had a recurrence of breast cancer, or have you died from breast cancer or any other cause? And 8 years later, we found that the groups that exercised during chemotherapy had a 82.7% disease-free survival. So that means 82.7% of them had no disease recurrence and had not died from breast cancer, versus 75.6% for the usual care group. And this difference of 7% is as good as many of the chemotherapy treatments that we use for cancer patients. So if this had been a chemotherapy drug, it would be hailed as a great intervention for these patients that can potentially improve survival. Now, we didn't have a large study. This was just 242 breast cancer patients, but it was suggestive of this idea that if you exercise while you're getting chemotherapy for breast cancer, you may in fact reduce your risk of having a recurrence or dying from breast cancer 8 years later. Another study we did with lymphoma patients called the Healthy Exercise for Lymphoma Patients trial. So this is another one of the many types of cancer that we don't have quite as much research on compared to, say, breast and prostate cancer. Here we compared aerobic exercise training to usual care, 122 lymphoma patients, some of them on chemotherapy and some of them were off treatment. 12 weeks of supervised exercise training. We were mostly interested in quality of life, and there were large benefits to quality of life in this study, but we did look at treatment outcomes as well. So again, looking at completing their chemotherapy cycles, there was no difference between the groups, but if anything, the exercise group completed a bit more of their chemotherapy. So again, evidence that it's not likely interfering with their ability to complete chemotherapy. The other outcome we tracked in this study is how did they respond to the chemotherapy? So you have these tumors related to lymphoma, you're given chemotherapy, and the hope is that the tumors are gone after you get chemotherapy. And we refer to this as a complete response, that the tumor is completely gone. Partial response means that the tumors have shrunk, but some tumors are still there. Stable response means no change in the tumors. And you can see here that the group that exercised while they were getting chemotherapy had a slightly higher rate of a complete response. About 46% of those patients had a complete response compared to 31% of those who didn't exercise. So this was the first evidence to suggest that if you exercise during chemotherapy, you might even make the chemotherapy more effective. And most recently, we've completed a study led by my PhD student, Andrea Morielli, and she was looking at exercise in rectal cancer patients while they were getting combined radiation therapy and chemotherapy. So they get the 6 weeks of radiation therapy for the tumor. And again, the hope is that that treatment will shrink the tumors, ideally completely, where you have no cancer remaining. And she compared a supervised high-intensity interval training program while they were on radiation therapy to usual care. And again, got a very suggestive and provocative finding that the group that exercised while they were getting radiation therapy had a significantly higher rate of a complete response to treatment. So again, this is a very exciting finding that suggests that exercise may in fact make some treatments more effective, like chemotherapy and like radiation therapy. So summarizing the evidence, I think, with all the studies that are done, we can say exercise is safe and feasible during cancer treatment. It does not interfere with treatments or worsen symptoms. We don't have much evidence related that it will make these treatments worse or worsen symptoms. It does maintain and improve health-related fitness, even during difficult cancer treatments like chemotherapy. It prevents and manages some side effects during treatment, especially for symptomatic patients. But we see a lot of improvements in fatigue, depression, sleep quality, and some of these other side effects, and overall quality of life. Exercise during treatment may improve treatment completion, treatment response, and long-term cancer outcomes, but we don't have definitive evidence yet. And this is an area of very active research. In fact, it's the area of much of my own research over the last 5 to 10 years. All of this combines then for our take-home message for cancer patients, which is don't take cancer lying down. We now have very good evidence to suggest that exercise is helpful for cancer patients during and after treatments. So the recommendations are essentially the same that you'll see for any other group or even the public health recommendations. You're very familiar with these guidelines of 150 minutes per week of moderate intensity aerobic exercise, adding 2 to 3 days per week of strength training exercises, Certainly, we encourage patients to be active throughout the day as well, and older adults may benefit from balanced exercise. So I think nothing that you're not familiar with in terms of what we might recommend. And the general exercise principles, I think, are the same as well. We encourage cancer patients to avoid inactivity. There hasn't been much research on sedentary behavior, but I think we can certainly suggest that they avoid inactivity. Some exercise is better than none. We make the recommendation, but there are some studies suggesting that even if they don't achieve the guidelines, there's some benefit. More exercise is better. So for some of these outcomes, there does tend to be a dose-response relationship. Start easy, progress slowly, and so we tell patients to exercise to tolerance. But it's really about individualizing the exercise prescription, and in cancer patients, this is going to be driven by patient function goals and preferences, but primarily by the side effects that they're experiencing. And this can be dependent on the type of cancer they have, the type of treatments that they're going through as well. So we really try and individualize it based on their cancer diagnosis, their treatments, and the side effects that those treatments produce. So this has led to all sorts of recommendations and support for getting exercise into cancer care. Now we have recommendations in Canada, the US, the UK. So most countries now are recommending exercise for cancer patients and survivors. I showed the Australian recommendation for a couple of reasons. One, as you can see, this is not recommendations from an exercise science group. It's one thing for exercise science people to say, yes, we think cancer patients should exercise. But this is from clinical oncologists. So these are the people who treat cancer patients. And they're very objective and they're independent. They have no vested interest in exercise. And they're saying it's very important for cancer patients to exercise. And the other reason I like these guidelines is they're very strong guidelines. So you can see here what they actually recommend. They're now saying that exercise should be embedded as a part of standard practice in cancer care and viewed as an adjunct therapy that helps counteract the adverse effects of cancer and its treatment. They also say that all members of the multidisciplinary cancer team should promote physical activity and recommend people with cancer adhere to exercise guidelines. And they finally state best practice cancer care ideally is to include referral to an accredited exercise physiologist or physiotherapist with experience in cancer care. So very strong recommendation from an independent clinical oncology society. So I think that shows you the level of evidence that we have for benefits of exercise in cancer patients. So how do we move this research into practice for cancer care? And I think there's really two models for doing this, and this is an important distinction for those of you who work in the community, those of you who are promoting exercise to cancer patients and survivors. One we can think of as kind of a clinical model. So these are for patients who are on treatment or they have late stage disease. So these patients have a lot of medical issues going on, and so there's a higher risk benefit ratio for these patients. They oftentimes need a medical consultation or medical clearance. The exercise prescription generally needs to be personalized because of the ongoing medical issues that they have. Supervised exercise is strongly recommended by a qualified professional to help these patients. And here the focus is on cancer-specific outcomes. These patients want to know what role exercise is going to play in helping them get through their treatments, manage their side effects, and deal with the disease. So this is, I think, a model that requires a high level of expertise, and of course, it requires a lot of knowledge about cancer as well as exercise science. And then the other group we can think of is more like a public health type of model. So these patients are off treatment, they've completed their treatment, they're otherwise cured of the disease. And for many of these patients, cancer is just a distant memory, and it's not really a compelling issue for them at the time. They've been through very mild treatments such as surgery alone, or they've completely recovered. They have a lower risk benefit ratio. Home-based exercise is feasible for this group. You can even do distance-based remote interventions. General exercise recommendations are more appropriate. and they're probably more focused on the benefits that the general population would be focused on: disease prevention, health promotion, because they don't really have any lingering cancer issues. So keeping that in mind, one of the best programs that you would hopefully have available in your community now is called the ACE program, the Alberta Cancer Exercise Program. This is being run by Nicole Kulos-Reed out of Calgary and Margie McNeely here out of Edmonton. And it's a really a clinic to community based type of program developed specifically for cancer survivors. And I encourage you to go to their website there if you want to find out more information about how you can access this program, or you can learn more about exercise for cancer. But there's three key elements to the program. One is exercise specialist training. So we know cancer patients want to know that the person they're seeing about exercise also understands cancer. And so the training that they offer here is for exercise professionals to become knowledgeable about cancer and how cancer affects the exercise prescription, safety issues, precautions, and so on. So they've got a face-to-face course, and I also believe an online training program where you can learn about cancer and become certified in that area. American College of Sports Medicine has the same idea, where you can get a cancer certification specialization. They then try and offer these community-based programs all over the province. So they've partnered with YMCAs, they've partnered with Wellspring Edmonton and other fitness facilities to try and have these trained people out in community-based centers so they can offer these programs to cancer survivors. And they've also built in a screening and referral component. So those patients that are at higher risk or may have more clinically oriented needs, they can get screened and potentially go into a clinical program. Other ones who are cleared for exercise can be referred out to the community. So I think this is an excellent program that's been developed to serve the cancer patients and survivors in Alberta. So how do you motivate these cancer patients and cancer survivors to exercise? I think we really need to take a cancer-specific approach for many of these patients. Many cancer patients want to know, what's the role of exercise for my cancer, and less about maybe the general health benefits. So here's some of the cancer-specific motives or benefits you can talk about. Helping them prepare for treatments, helping them complete treatments, respond to treatments. I've talked a little bit about the data we have there. Managing treatment side effects, recovering after treatments, reducing the risk of recurrence and death from cancer. These, I think, are going to be the most compelling benefits for cancer patients. So if you can make it more relevant to them, specifically by focusing on cancer, I think that's what's going to be helpful. There's also lots of people that are critical to cancer patients in terms of influencing their decision about whether or not exercise is good for them, whether or not they should, what types of exercise they should do, and so on. Probably the most important people are the oncologists. So these are the medical doctors that treat cancer. And many cancer patients are very concerned about what their oncologists think about exercise, especially during treatments. Most oncologists now in the province of Alberta and around the world, for that matter, are very supportive. So I think you can confidently note that their oncologists will be supportive of them exercising during and after treatments. We can also get support from other oncology care providers. Nurses are very supportive, and many of them are delivering these programs. Physiotherapists, nutritionists, and even people doing psychological counseling are now recommending exercise for various psychological issues that cancer patients might face. The cancer treatment centers themselves are very important to patients. What does the Cross Cancer Institute think about exercise? What does the Tom Baker Cancer Center think about it? And again, these groups are very supportive. Cancer societies, certainly many people when they're diagnosed with cancer will go to the Canadian Cancer Society. The US has the American Cancer Society. And these organizations, their opinion is also very important to cancer patients, and they're very supportive of exercise. In fact, many of them now have materials on their website recommending exercise. And then, of course, other cancer survivors as well. Cancer-specific barriers or constraints. So, probably the unique barriers for cancer patients are going to be these treatment side effects. Fatigue, nausea, diarrhea, neuropathy. You can look at the list, urinary incontinence. These things all make it difficult for cancer patients to exercise regularly. So coming up with creative strategies about how do you exercise when you have urinary incontinence or you have diarrhea or peripheral neuropathy are very important. Most of these side effects will dissipate after treatments, but some do linger. So it can be an ongoing issue even after patients complete treatment. Some might still have peripheral neuropathy. They might still have fatigue or other challenges. During treatment, it's also a very busy time for these patients. They have all sorts of medical appointments. They have financial challenges, work-related issues, and stuff as well. And then access to programs and qualified personnel, which I think a program like ACE can really help address. So what are the safety risks of exercise in cancer patients? So even though exercise is generally safe and beneficial for patients, there are some things you have to watch out for. First, exacerbation of symptoms. So although we think exercise in most patients will help with these symptoms, pain, fatigue, nausea, and so on, it can, in fact, exacerbate some of these symptoms, particularly if it's high-intensity exercise or it's things like, surgical wounds and stuff and so on. So you do have to be careful to prescribe exercise that's going to not exacerbate some of these symptoms for patients. Immunosuppression was one of the early concerns from oncologists. Of course, patients on chemotherapy are immunosuppressed. They're at high risk of infections that can slow their treatments or stop their treatments altogether. So they're very concerned about being immunosuppressed. And these doctors and patients are all aware that, marathon runners and triathletes sometimes become immunosuppressed. So early on, this was a big concern. So obviously not going too hard with too high intensity or too prolonged amount of exercise during these treatments is important. Falls, these patients are at a risk of falls because many of the side effects of these drugs and treatments are things like dizziness, ataxia, peripheral sensory neuropathy. So they can have problems with balance and coordination. So you do have to watch out for risk of falls, but things such as putting patients on treadmills or having them go outside and walk during the winter months and so on. Probably the biggest one nowadays that most people seem concerned about is the risk of bone fracture. So unfortunately, many types of cancer do spread to the bones. Breast cancer, prostate cancer, many other cancers will spread to the bone. And the bones can become a little bit unstable depending on how much metastases they have, the location of the spread to the bone, and so on. So this is where you want some medical involvement from the doctors to find out, does the patient have any bone metastases? Where are they located? How severe they are? And try and come up with an exercise prescription that can be done around some of these metastatic bone lesions. And lastly, lymphedema. So this is the swelling of the arm, which can be very common in breast cancer. It can be in other cancers as well, and you can also get lower limb lymphedema. So progressive resistance exercise can help with lymphedema and swelling, but again, you have to make sure the lymphedema is being managed and treated before they can do certain types of exercise. So who is likely to benefit from a cancer-specific exercise intervention versus a general health intervention? So newly diagnosed cancer patients who are starting treatments will want to know, what's the role of exercise for cancer treatments, helping me prepare for treatments, manage side effects, recover treatments. If they're on treatments, same issue. Cancer patients with poor or modest prognosis. Unfortunately, there's many cancers still, like pancreatic cancer, liver cancer, lung cancer, where the prognosis is not great, and those patients will want to know, how is it going to help me manage my cancer? What's it going to do in terms of my survival benefit from this cancer? And then patients with advanced or metastatic cancer. So all these groups of patients are really focused on managing their cancer. And the more you can make the exercise prescription relevant for managing their cancer, the better. The exception are these long-term survivors of early stage cancers. They have a good prognosis. They don't have any lingering side effects. And for many of them, as I say, cancer is just a distant memory. It's not a compelling issue for them. And you can probably motivate these long-term cancer survivors just like you would other members of the general population. So the intervention recommendations for cancer survivors. I would say incorporate cancer-specific benefits where it's supported by the evidence. That will make it most relevant to these patients. Invoke cancer-specific social influencers who are important to the individual. Talk about how the oncologist supports the exercise, how the Canadian Cancer Society is supportive, how the Cross Cancer Institute and other organizations really do strongly recommend exercise for patients. Those are the individuals and groups that the patients will be concerned about. Address the cancer-specific barriers that the patient's experiencing, as well as precautions. And then many of these factors will all vary by the cancer type, disease stage, treatments received, and the cancer trajectory. So in summary, cancer is a compelling disease for most people. Most cancer patients want cancer-specific information, not general health information, and that goes for exercise as well. And cancer affects all aspects of exercise behavior change interventions for cancer patients, including the motives that they have, the barriers they face, the social influences that they have, and how we deliver these programs, who delivers them, what, when, and where. I'll end by acknowledging many colleagues, students, staff, and study participants who have contributed to this research, and also the support that I received from the Canada Research Chairs Program, a CIHR Foundation grant, and also Apple Fitness. Thank you for listening.
Thanks, Kerry. There are two questions that have come up on the chat board. The first one is, does it make a difference if the person was previously active or what level of activity they had before their cancer diagnosis and then participating in activity?
Yeah, that's a great question. And we do find that it makes a big difference. So anyone who is active before a cancer diagnosis, it's much easier convincing them of the importance of exercise being maintained during their treatments and after their treatments. So generally, they're already believers in the benefits of exercise. Also, if they have some level of fitness and some experience with exercise, it's much easier to motivate them to keep going during difficult treatments. If you have someone with no experience with exercise who are starting treatments, it will be more challenging. And in fact, not all patients can exercise during treatments. I think this is a really important point. We've done many surveys of cancer survivors asking them, when would you like to start an exercise program? About half of them say, yeah, I'd like to start at the time of diagnosis during treatments. And I suspect many of those were the former exercisers. But we also get half that say, there's no way I could have exercised during treatment. I'd like to start after my treatments are completed. And the normal time frame is 3 to 6 months after. So we don't want to pressure patients to feel like you have to exercise during treatments. Some of these treatments are very difficult, bad side effects. And for some patients, waiting till after their treatments is a great time to start, and especially if they had no previous experience with exercise.
Okay, the next question is specifically about the ACE program, whether it's open to providers outside of Alberta. So not the participants, but can providers learn about it if they're not, or become, trained in it if they're not in Alberta?
Yeah, good question. And that would, I think you'll have to follow up with Margie McNeely and Nicole Kulos-Reed. I believe anyone can sign up for the training module. So if you're just interested in learning about cancer and learning about the role of exercise and how to integrate the two, I think you can sign up for that training module that will help with some expertise in cancer. But obviously the program, I don't believe is offered outside of Alberta.
What is your recommendation for people who are in northern communities, rural or remote, where access to these kind of programs are limited?
Yeah, that's a great question. And again, I think the ACE program is attempting to address that. It was face-to-face originally. Most of these programs have been supervised, many of them in Edmonton and Calgary, and some of them have gotten out into smaller communities. So I think it is spread out around Alberta. But in terms of more rural or even smaller communities, you know, with the start of the COVID-19 shutdown of the supervised program, I think Margie and Nicole are developing an online delivery of the ACE program. So I don't know if that's been launched yet, but I think it's going to be launching very soon. So follow up with ACE, and hopefully there'll be an online remote version coming out very shortly.
Okay. The next question is, how much is too much? So what level of exercise do we see a decline in benefits?
Yeah, it's a good question, and we don't really know the answer to how much is too much. I think most patients pace themselves, and they do exercise to their own tolerance and don't really go over the limit. You know, would I recommend someone train for a marathon during chemotherapy or triathlon? That's probably too much. You know, I would stick to the guidelines if they've been active before and are quite fit. And, you know, there are marathon runners who are diagnosed with cancer and triathletes diagnosed with cancer. And many of them do like to keep their training program, but obviously they're much fitter. For the average patient, I think following these recommendations, especially during treatment, is a good goal. And then after treatment, they can sort of take it a bit further if they're interested in becoming even fitter.
Okay, does anyone else have questions that they'd like to ask Kerry before he finishes up? I don't see, one of the questions is this being recorded and available? Yes, we are recording it, and we will make it available on our website or through our YouTube channel. We'll have to determine that, but we'll let you know. Okay. Not seeing any more questions. I'd like to thank you, Kerry. As usual, you provide us with lots of great information, and I appreciate the fact that you've taken the time out of your day and more than that in preparing this presentation. So appreciate your time, and we will shift on to our next presentation.